I'm Dr. Sheila Segerson, veterinary behaviorist and director of community solutions at Maddie's Fund. Joining us is Dr. Wailani Sung, a very rare individual who, in addition to being a veterinary behaviorist, also has a master's and PhD degree in psychology. Dr. Sung previously led the shelter behavior program at the San Francisco SPCA and is the founder of Bay Area Vet Behavior. Dr. Sung is a well-known author and public figure. I'm guessing many of you saw her in the Netflix documentary Inside the Mind of a Cat. Dr. Sung will be talking about meeting the needs of behaviorally challenged dogs in the shelter. After Dr. Sung's presentation, we'll watch 2 short videos from Joanna Pagel at Shelby Humane Society and Dr. Joyce Voss, Director of Veterinary Services and Animal Care at SICSA Pet Adoption and Wellness Center. And then we'll have time for Q&A with all 3 speakers. Welcome, Dr. Sung. I'm so excited that you're here with us today.
Thank you, Sheila. I'm super excited to talk to you. And let's get started. We're going to talk about the behavioral and emotional health in shelter dogs. We know that in the shelter, all the pets are exposed to many stressors. And you need to keep in mind, they are exposed to unfamiliar people, unfamiliar animals, different sights and sounds, different schedules, and also different food. So everything they're used to has been stripped away. So how resilient are you when you're exposed to such stressful situation? Before we get started, it's really important to me that we all have a very clear understanding when we talk about fear. What is a definition of fear? It's an emotional reaction of apprehension and fright due to the actual presence of the very thing the animal is afraid of, which is different from anxiety. Anxiety is the emotional reaction of apprehension or uneasiness to the anticipated danger or threat. So when we're fearful, we're reacting to something in the presence of something, whereas with anxiety, we are anticipating something bad is going to happen. Often in the shelter, we encounter frustration in dogs. So this is when an animal is motivated to do a specific behavior, but they're not allowed to do so. There's no outlet. So that leads to a lot of frustration. And I think everybody's familiar with stress. It's a sum of the body and mind's reaction to anything that disrupts our normal baseline. So the body's response to stress is to try to return everything, body and mind, back to their normal state. If you have not accessed this resource, please sign up for Fear Free Shelter so that you can download this helpful chart regarding fear, anxiety, stress, and frustration scale for shelter use. It's made into 3 different levels, green, yellow, and red, so that you can educate staff and volunteers on how the dog is doing, what the dog is doing, and if that's appropriate behavior or not. And before I get started, we're going to talk about dogs today, but it's really important that underage puppies should be placed in foster homes as soon as possible. I don't believe that puppies have a place in the shelter if we can foster them out. They should come back at 8 weeks, get spayed and neutered, and then be put on the floor for adoption. We know that puppies in the shelters have a higher risk of contracting infectious disease, and there's also lack of adequate socialization in shelter. Fosters do a better job at home socializing our puppies. And the behavior treatment plan, we all know that in order to manage problematic behavior, we know that we need to have a management plan that talks about safety and avoiding triggers. We also talk about training foundation behaviors and alternative behaviors. And if possible, some shelters can do behavior modification like counter conditioning, desensitization. And we also will briefly go over how supplements and behavioral medication can play a role in helping these behaviorally challenged dogs. So we know that the shelter pets experience the world differently from us, and we can do simple changes in the shelter setting to reduce fear, anxiety, stress, and frustration. We can address tactile, olfactory, visual, and auditory needs, and especially gustatory needs of our shelter dogs. When we all think about tactile, everybody thinks, oh, tactile, okay, that means touch, right? So when we think about touch, everybody thinks about flooring because we typically have flooring in the shelter that's easy for us to sterilize, but there are certain areas that we can utilize non-slip flooring, area rugs, or rubber mats. So this is what people think about. In my mind, I think about flooring, but I also think about like tactile with dogs, their paws touching the flooring, but their teeth, right? So in this picture, you give them options. You give them lots of beddings, and they have a choice between choosing the use of bedding and using a hard floor, lying on the hard, cool floor. When I think about tactile, I also think about teeth, right? Because dogs touch not just with their paws, but they can touch where their teeth. They have sensory receptors in their teeth that allow them to get a gauge of how hard and how soft they can bite. So when we think about tactile enrichment, it's not just about flooring and things they can rest on, but also giving them things that they can tear up, right? They have so much joy in ripping up all the items. And as you can see, that picture on the left is my office. I have a German Shepherd puppy, and he's my official shredder. So all the junk mail he shreds, and he has a great job. He loves that job. Tactile also refers to playing with toys, giving them a wide variety of toys that they can choose from. So soft toys plushy toys that they can really sink their teeth in, harder toys that can give them some sensory feedback. That is really important. When we move to the olfactory, we talk about things like, what can we do in the shelter environment? In the shelter itself, of course, we can take these dogs out on walks, but in the shelter itself, we can get stuffed cardboard tubes or boxes that we can put sheep's wool in, or horsehair, brushed rabbit fur, even cat fur, something that's organic. And I use these examples because in the shelter I previously worked with, we had access to people that own sheep and horses and rabbits. So they would brush their animal, groom their animal, or clip the sheep. And they would bring in all this fur and wool, and we could put them in little cardboard tubes. You can put them in little boxes. And we had a little garden that we had a room where we had all these little items available so they can sniff to their heart's content. So these are things important to keep in mind. And this is just an example of taking your time. When you have volunteers and staff taking the dogs out, they don't have to rush their dogs through. They can just take their time, slow down, and let the dogs sniff to their heart's content. This is super enriching for their brain. The olfactory lobe is huge. Let them take in all the females, all the sensories that they are not allowed to have or don't have access to in the shelter. So this is very enriching. It's also a little bit tiring for them, which is kind of something like we like in the shelter. We want to fulfill their brains. And then we also want to think about, visual. Dogs are sensitive to quick movements. And keep in mind, a lot of the buildings that we have made, we install lighting that's fit for humans. And think about, using softer lighting, 60-watt lighting. Is it possible to replace some of the light bulbs with LED light bulbs? And can we put it on a dimmer so that dogs that are really shy and fearful, we have them in slightly dimmer setting so it's not so alarming to them. We know in the shelter world that we need to learn about body language and avoid hard staring at dogs. And in the shelter that where dogs are stimulated by the sight of other dogs, maybe a visual blocker would be super useful for some dogs that become really excitable, or for some dogs that get really scared and hide and get frozen because the sight of another dog or a person is really scary for them. These are things that's really important. And when we think about auditory, we think about using a white noise maker. This is just a droning noise. You can play it at a loud volume, but white noise maker, think about like when your heater turns on in your home, or when you have a fan playing in the room. It kind of drowns out some of the background noises. It doesn't drown out everything. But if you have the white noise maker and you can play some options for them that can be enriching. So things like classical music, an example is through a dog's ear that plays classical music at a 60-beat tempo, mimicking the beating heart of the mother dog. That can be super helpful for some dogs. There's been one research study done that indicated in their shelter, the dogs really responded well to the sound of reggae music. And it might be that reggae has that like melodic, rhythmic sound to it, that beat that some dogs find really soothing. And another study indicated in that particular shelter, the dogs really like the sound of audiobooks, someone talking to them. the sound of someone talking to them was really helpful. In my previous shelter, we had reading time with dogs where volunteers would come in and not just spend time with the dogs, but just read a book out loud to them. And some of the dogs really enjoyed it, really enjoy having someone in their room or outside their kennel and just hearing the sound of their voice talking to them, reading out loud. That brought them a lot of joy. Now, when we think about the different types of enrichment, I like to break it down into different categories so that if we break it down into different categories, we can easily make a checklist and we can go throughout the day and say, hey, did I fulfill at least one thing out of this category? So one category is people interactions, right? I know every shelter should be able to fulfill this, being able to take a dog out for a walk or a little play session, even physical contact and attention, right? Maybe if you can't take that dog out, can we stop in front of the kennel, spend a few minutes talking to the dog, petting the dog if possible, a little bit of training. If we can't take the dog out for training, we can do behind the bars training, and I'll go into that in a little bit more detail. Can we do dog day dates? Right? With dog-dog interaction, if the dog is pro-social and gets along with other dogs, let's go ahead and do play group if possible. If not, can we do some parallel walks, right? And in the environmental issue, the environmental area, we need to think about what can we do in their room to enhance their environment. So here is a video of my shelter dog, my shepherd that I adopted during COVID. And we worked really, really hard with her to get her to sit and tolerate waiting for us to throw her jolly ball. The jolly ball is her favorite toy in the whole world. And the reason I'm showing this is like, it's great for people, staff and volunteers to take a dog out and throw the toy. But sometimes it's really important if we're dealing with dogs with some behavioral concerns, can we help them work a little bit on some self-control? A little bit impulse control can go a long way. Just asking a dog to sit prior to us tossing a ball so there's more structure in our interaction can be super helpful so that when they see someone, they automatically go, oh, I know how to interact. I'm going to sit and then I can get to interact with this person. I get to play with my ball. So that's really important. And I think that it's something that we should really think about in all our interactions with dogs and play, not just play, and they get so excited and they kind of lose their mind a little bit and then they get overstimulated, but keeping it at a point where they can get really excited and then helping them bring it down, getting excited and helping them bring it down. In this video, the video is courtesy of Joybound People and Pets Shelter. We briefly mentioned about training in the room. So it's really important. We know that studies show that adopters are attracted to dogs that come to the front of their kennel and they can do things like sit or lie down in front of the kennel. This is what I call, there's no bars here, but this is something we call behind the bars training. We have someone come in front of the kennel and we just ask them to sit. We work on a brief sit and toss treats for them. And I don't know if you guys can see, but at the very end, this little dog, she automatically came and sat because she goes, oh, wait. In the beginning, she was like, what's going on? This person's tossing treats. She sat and then treats came. And then she slowly realized, oh, wow, as soon as I sit, treats come. So this is, teaching the dog a positive association when someone comes to your kennel, let's sit, right? And it gives the dog something to do, something to think about when someone comes. Yes. It's really important when we do positive reinforcement training methods that we do it because think about the consequences of what we're doing. We really want to reinforce appropriate interaction, increase the human-animal bond. And when we use positive reinforcement training methods, we increase the dog's confidence. We help them increase self-control. We also increase trust in people, and we decrease their fears and anxiety. It's really important, if you look at the research literature out there, that there's some studies that indicate that dogs that have been trained using punitive methods, they are considered, one study considered them, they label them pessimistic. And the reason they label them pessimistic is that if they try to teach them a new behavior, the dogs would try like 1 or 2 times and then they give up and they kind of shut down. Why? Because in the past, they were punished for behaving incorrectly or not doing the right behavior. Whereas the dogs that were trained using positive reinforcement, they were labeled the optimistic dogs. When they were taught a new behavior, they would keep trying and keep trying. They're like, is it this? Is it this? Is it this? So it was really exciting to see how engaged and how enthusiastic they were in learning. So it's really something to keep in mind. So when you have dogs that are trained using positive reinforcement, when you increase their confidence, when they see something new, they're just like, oh, hey, a tunnel? I've never seen that before. I'm going to go right through it because, you tossed a treat. I'm going to go chasing after it. We want to avoid the use of punitive methods because they exacerbate the pet's behavior problems and can increase the pet's level of anxiety or aggression, right? Dr. Heron found that dogs with aggressive behaviors had increased incidence of aggressive behaviors directed towards the owner or other family members when punitive techniques were used. So it's really important that we help educate our adopters, and we also want to think about how we want to treat our shelter pets, right? So we want to make sure we are decreasing anxiety and fear, and sometimes using the punitive methods can increase that. We also need to think about punitive methods sometimes suppress the behavior. They suppress the expression of behaviors and expression of warning signals. So that can be very damaging to a dog. Now, when we are in the shelter, depending on the capacity of your shelter, there are simple things that we can do with behavior modification. We can do simple things like counter conditioning, which is a technique that we use to reverse previous negative emotional responses to a certain stimuli with a positive emotional response. So we use either food rewards or petting or praise, toys or play sessions, things that make the dog excited and happy. So a common example is if a dog barks or is fearful towards another dog while on leash, we keep the dog far enough away that every time the dog sees the other dog, we immediately give the dog something that it finds rewarding and positive, whether it's a high value treat, praise, a squeaky toy, or a tug session, anything we can do to reverse that negative emotional response. So one of the common examples I like to give is, let's say you have a really snarky neighbor. Every time you walk out the door, if you happen to walk out and the neighbor's out there, they always make a nasty comment to you. And you're like, oh, every time you see that person, you just feel kind of bad because something bad's going to happen. They're going to say something nasty to you. And you ignore it. But what happens if you walk out and every time you see your neighbor and they say something nasty to you, you get $1,000? You're like, what? $1,000? I saw that guy 4 times today. I got $4,000. That money is not going to make you like that guy, right? But it turns your emotions from negative to less negative to maybe neutral to maybe slightly positive, right? It increases your tolerance for your neighbor. So I want you to think about it in those terms. And if possible, if we can do more specific behavior modification, we can do desensitization along with counter conditioning. And these are mainly like your controlled exposures. You want to do gradual approaches towards strangers and other animals. Can you do having other people approach the pet while it's on leash? These are common things that we do in the shelter, being reached for or being petted, being handled. These are things that we can address in the shelter if it is possible in your shelter. And another video that is really important is I really encourage a lot of my team members to walk down the row of dogs and toss treats, right? And as you see this dog on the right, he's barking. The first time she did like 2 or 3 barks. The second time he did like 1 whine. But as you see, as our trainer walks down the rows, barking becomes less intense. And we're doing 2 things. We're adding enrichment, right? We're forming positive association with someone in front of my kennel. And we are reinforcing the dogs for being quiet. So when I ask staff members to do it and they're committed to doing this, what happens is after 2 weeks, they come up to me and go, oh my gosh, I can't believe it worked. What worked? Well, every time I walk into a run, I keep tossing treats regardless of whether they're barking or not. And over time, I started deliberately tossing the treats when they're not barking. And then after 2 weeks, the dogs see me and they get excited and they no longer bark as intensely, or some of them even stop barking. So this is something we can do to help a lot of dogs in our shelter. And think about things that we can do that are simple. If possible, we can, advertise and sign up fosters to take a dog just overnight, one night away from the shelter. Their cortisol level really significantly drops. And yes, when they come back to the shelter, the cortisol level does increase, but it never increases back to the original high level, right? So that's really important. The other thing you can do is there staff members in your facility that can take a dog for a couple of hours a day? Can they spend the entire day there? Can they spend an hour or two in the office with the staff member so that they have time to get away from the shelter, get away from the other dogs, all the clanging noises, and have an opportunity to take a deep breath and decompress, right? So this is really important to consider if that's a possibility. And I do agree that if you have pro-social dogs and you have the capacity, it's really important to consider, meeting the dogs and see if we could house 2 dogs that are pro-social together. And if that's not possible, how do we continue to let them interact with other dogs? Well, we do it with, play, group play, or we do parallel walks. And these are my dogs. And the one in the middle is a 5-month-old shepherd. As you can see, he kind of walked away and he's like, oh, wait, I need to come back and check in with the older dog because he's not very confident, right? And this is where the other dogs can help the shyer dogs become a little bit more confident. They're a little role model for them so that they can go, oh, okay, wait, they can help be there. Their very presence is enriching for the other dog. They learn how to interact with dogs appropriately and also model their behavior after the other dog. Oh, you're not worried? Okay, maybe I'm not worried. The other thing is dog play. When you have shelter dog play groups, it's really important that all human members of the team can adequately monitor behavior and assess when they need to break it up. One of the things that I'm opposed to is letting dogs play out of control. And then what do? The dogs are so excited. Okay, playtime's over. And what do? Then we immediately bring them back into the kennel, right? They go from the highest of highs and immediately they're put in a very restrictive environment. Some of the considerations is I would love for people to let the dogs play, and every minute or two, let's break it up in a positive way. Call the dogs over. Let's do a sit, get a snack, get a drink of water, and then let them play again. And when they're playing, it's really important that there's mutual play. One dog is wrestling, right? And then the other dog wrestles, right? One dog is chasing, and then they take turns. If they're not taking turns, are they truly having a good time? Because we have learned in the shelter that we thought one dog really enjoyed being chased because she would run. Over time, and we kept taking her out because she got along with everyone. Over time, we learned that she actually didn't like it. And her way of coping was running away from the other dogs. And over time, she learned to bark and lunge and snap at the other dogs to keep them away. So we kind of overplayed her. So these are important things to think about when we're doing dog play. And in-room enrichment, well, this is where we are addressing the gustatory portion of environmental enrichment. Gustatory is taste, right? So these are simple things. As you can see, they're just leftover boxes of things, medical supplies, soda cans that came. Just putting 2 boxes in the room, putting something easy in there for the dog to go and sniff. Wow. It's not rocket science, but for a dog, that is so interesting. It is something new. Having just a simple box or 2 boxes in their kennel. Wow, what's this, right? There are smells attached to that box that we don't think about. And of course, we put in tasty treats, right? But we encourage dogs to explore. So we are encouraging them to express normal behavior. Approach something, use your nose, go in and look at it. And it doesn't take very long. I think the video that was taken was about like 3 minutes, and I cut it down so that you guys don't have to see see her coming in and out of the room. But it's also funny to see how a dog learns. He always goes to the box where he found the last treat, right? So he remembers, oh, last time the treat was in this box. And something simple you guys can do, I think that something that's really important is it doesn't have to be fancy toys. It could just be a nylabone. We smear almond butter on it. I toss it in a box. I cover it with tissue paper, and then we put it in a box and let the dogs go to town, right? We use in our previous shelter, we use empty glove boxes. We put stuff in there. We put tissue paper, cardboard paper, packing paper, and let the dogs have fun. So it's really simple that your volunteers can be trained to do. We have volunteers that come and pack those little cardboard tubes, those toilet roll holders, right? And we pack it full of things until we have a supply. And if they pack it full of moist food, we put it in the fridge, and every day the dogs get enrichment. Ideally, in my mind, what would a dog daily schedule look like? Well, a dog's daily schedule, in my mind, will look like, we take them out for a quick potty walk so that they can come back into their room and there's breakfast waiting for them. Maybe mid-morning, we have a walk with a volunteer, some type of engagement. And when we come back from the walk, right? Remember, it's kind of like what I said. We go on a walk. It's so exciting. We had fun. I saw this. I saw that. I came back in the room and my room is sterile, right? So instead of bringing it back in a sterile room, some things to think about in regards to enrichment is make the room exciting. We come back in and there's a puzzle toy in the room. Or we come back in and the volunteer spends a few minutes sitting in the room with me, petting with me, or talking to me, or reading a book. So the dog comes back in and there's something else to do before the volunteers leave, right? And maybe for the behaviorally challenged dogs, maybe sometime in the middle of the day, we have a session with the behavior team member on training or behavior modification. Later on at the day, we have another walk and enrichment. And you see those big bars I put in? This is where I think we should have enrichment. So they don't come in and, oh my gosh, you come back to a sterile room, there's nothing to do, right? We want to come back in and there's something to do so they like going in their room. There's something they can focus on to take their mind off of anxiety or not liking to be here. And at the very end, in the previous shelter, we did frozen enrichment. So basically we have these little gigantic ice cube trays that we would fill with chicken broth, diluted chicken broth. So every dog had an opportunity to get a frozen chicken broth at the end of the day. And it's totally up to them whether they want to interact with it, whether they want to eat it, lick it, or just let it melt. And it was easy for the staff member to clean up. Now, when we talk about, our behaviorally challenged animals, we know that they're having a hard time in the shelter adjusting. And what are things that we can do? Well, we could start with some natural supplements. If you're starting, remember the FAS chart I showed you, green, yellow, and red. If we're starting to see some yellows, should we go ahead and preemptively put them on some natural supplements, right? So things like the dog appeasing pheromone, synthetic pheromone, you can plug in the wall. All hallways should have one. It works for 500 to 700 square feet. And it is the pheromone that mothers' dogs produce while they are nursing to keep the puppies calm, right? It sends them a message of safety, security, and reassurance. Now, in my experience, I would say that in my private practice, we have about 60 to 70% of the dogs that will respond to this. So not all dogs in the shelter will respond to it, but some will, right? And we know it's not one thing that's going to solve the dog's problem. It is a little bit of this, a little bit of that. What can we do to help them build up some resiliency and some coping mechanisms? These are over-the-counter natural supplements, so you don't need a prescription for this, but alpha-casozepine, or the brand name is called Zilkine. It is the alpha S1 casein portion of milk. It is similar in structure. It's a 10-sided peptide to GABA, and it has an effect on the immune system, the opioid system, and basically what it does is it fits like a key and lock mechanism into the benzodiazepines, like the Valium receptors. So what happens is that it can help reduce anxiety without triggering some of the side effects that you see with medications. Another option is L-theanine, brand name Angstitane. They have an effect on increasing GABA, which is an inhibitory neurotransmitter, and it also inhibits binding of glutamate receptors. Glutamate receptors are your excitatory receptors, right? So if you're increasing the GABA receptors, which are inhibitory, you're calming the animal down. It also has an effect on increasing serotonin and dopamine. And my favorite is using Soliquin because this product combines L-theanine, and L-theanine, what we just read about, it increases GABA, dopamine, and serotonin. What I didn't say is that L-theanine also promotes the alpha brain waves. The alpha brain waves are the calm brain waves that occur when we are meditating, or they occur as we are just drifting off to sleep. The alpha-lactalbumin is found in whey protein, so it has high tryptophan content. Increased tryptophan allows the dogs to make more serotonin in the brain. And then it has the theodendron and magnolia plant extracts that both have a similar effect of reducing anxiety. So this is 4 in 1. And then I don't have a lot of time to talk about this, but it's really important to address, like, when would we use psychoactive medications in the shelter, right? And keep in mind, we're using it to reduce overall level of anxiety. We're trying to lower their baseline. Why? Because if we reduce the lower overall level of anxiety, we can reduce the intensity of reactions, we can reduce the duration of reactions and the frequency of reactions, and also help the dog recover after an incident. We are not looking to sedate the animal. Some side effects can include sedation, and depending on the medication you use, if the dog is sedated, right, it's really important to determine, are we using the right dose, or is this a side effect or indication the dog cannot tolerate this medication? Sometimes a dog may be sedated for a day or two and their body adjusts. But we are not looking to sedate. If we're sedating animals, we're doing them an injustice. So it's really important to keep that in mind. And it's really important to monitor the effects, especially when you start medication the first day or two. The first week, it should be daily monitoring. So how do we choose psychoactive medications? Well, we do it in the shelter the same way I would do it for my privately owned patients. You need to really think about, what are we trying to do? Are we thinking of using a short-acting medication, right? Short-acting medications mean they take effect in 60 to 90 minutes. So they would be taking effect that same day. Are we looking to sedate an animal? Maybe we need to do a pre-veterinary visit dosing, which means, okay, the shelter medicine needs to take a look at this dog today. So can we give them something so that they are a little bit sedated so the examination is easier? They're more tolerant of the handling, right? What about side effects? Be aware of what side effects that can happen. And most commonly, I tell my clients, sedation, agitation, lethargy, vomiting, diarrhea, decrease in appetite are the 6 common side effects that I can see with any psychoactive medication. And are you thinking about, maybe we need to put this dog on a maintenance medication? Why would you put a dog on a maintenance medication? Maybe because this dog is showing you a great deal of anxiety, and the dog is going to stay in our shelter behavior program for at least a month while we work on issues. If that is the case, then yes, let's go ahead and do a maintenance medication. And are you thinking about targeting a specific neurotransmitter or receptor? These are questions you need to talk to your shelter veterinarian about, right? And this is what they should keep in mind. And is our goal to decrease anxiety. And also in the shelter, something that's really important is dosing frequency. How frequently can we dose dogs? Can you do it once a day, twice a day, or 3 times a day? If you can't do 3 times a day, that limits your medication to certain classes of drugs. So behavioral meds are all human generics that we use off-label. What we commonly use are gabapentin, the SSRIs. So these are your Prozac, Paxils, and Zoloft type of medications, your clonidine, your trazodone, or your tricyclic antidepressants. So that's your clomicalm or clomipramine. So the SSRIs and the TCAs are your maintenance drugs. The purple, orange, and green are your short-acting medications. So these are what I commonly use in the shelter. And one of the things I want you to think about is you need to have a way of monitoring them. And also you need to think about the animals in your care. Even if they're on medication, we need to think about pathway options if you're dealing with behaviorally challenged dogs and we're giving them the optimum environment that we can in our shelter within our limitations, within what we can do. Within our capacity, we need to keep in mind signs of decline, right? It's really important every day we walk through and do that FAS score and look at our dog. Is that FAS score changing? You know, is the dog shutting down? Is there increased agitation even while on medication? Is there signs of aggression? Is there increased incidence of bites? Is there signs of decreased resiliency, right? When that happens, what are your pathway options? You know, do we let it get to that point? Do you have something in your protocol that says, hey, after 14 weeks, we need to implement this option before the dog shows signs of decline? Or do we have a protocol that when dogs show one of these signs of decline, we have a different pathway option? Can we foster these dogs out? Can we transfer the dog to another shelter or rescue organization? Is there a working dog program that we can enroll this dog in? Or do we really need to think about euthanasia? And when you think about euthanasia, the really important thing to think about is I always go back to the 5 freedom. That's really important. We can deal with hunger and thirst. We can deal with pain, injury, and disease and discomfort. What we have a really hard time working on and focusing on and making improvements on is reducing fear and distress and fulfilling their needs. Can these dogs express their normal behavior? So if we can't, is behavioral euthanasia a consideration, right? This is a deep discussion that the organization needs to have with, you know, your senior executive team. You know, where are we at? What are our pathways? I think it's really important to have these clear pathways to follow when the dog is declining. Thank you so much for your time. If you want to follow me, you can. These are some options. And if you have any questions, please feel free to email me.
Thank you, Dr. Sung. Next, we'll hear from Joanna Pagel at Shelby Humane Society and Dr. Joyce Voss at SICSA Pet Adoption and Wellness Center.
Hi everyone, my name is Joanna Pagel. I'm the Operations Director and Behavior Manager for Shelby Humane Society in Columbiana, Alabama. And today I'm going to talk to you guys about our staff group training class. We hold this every Monday afternoon. And I did this because I wanted a way that we could work on staff handling as well as some volunteers, improve their confidence, make sure that they're doing everything properly, regularly look in, have an opportunity to train our new staff in an active scenario. I also wanted an opportunity to work with some of the more difficult behavior cases that needed some group setting type of learning, like leash reactivity specifically, and a different way to provide enrichment for dogs that maybe can't do play groups or just straight up don't enjoy being out in the yard by themselves. The benefits that we have seen have been really awesome. We have definitely seen an improvement in the staff and the volunteers' handling abilities. We got more confidence with dogs who might be a little bit rough to handle, a little bit hard to get out of their kennel, reactive, pulling on the leash. That's a really big thing that people were just kind of having to grin and bear. And now they are much more confident dealing with those things because we can actively address them. I can also trust my staff and my volunteers with a little bit more difficult scenarios because I know I've sat there and watched them handle those scenarios and we've worked on it together. We've definitely seen a reduction in the kennel stress and the overall reactivity of our dogs. We try to rotate a large number of dogs through this, and even though it's only once a week, we can still see those benefits lasting throughout for those dogs that keep up with this. We also have been able to get really nice footage of dogs that are working in a very adoptable looking way. So they're working around other people and other dogs in a distracting environment. They're engaging with their handlers and they're doing these obedience commands. So it makes for really nice content for our posts just on our social media pages, but also we can use it to send to our rescue transport partners that will pull dogs from us occasionally. And there's actually a yellow dog named Nala who this footage was sent to a shelter that was interested in her, and they ended up deciding to pull her based on how wonderful she looked in this footage. We all look forward to Monday afternoons now, so that's a very big positive. So I really hope that you guys are able to implement something like this in your own shelters, and I am more than happy to answer anybody's questions about this program. Thank you.
Hello. Today I want to talk with you about how we support our shelter dogs by using behavior plans. SICSA Pet Adoption and Wellness Center is a managed intake facility in Southwest Ohio. In 2023, our average dog length of stay was up from 27 to 31, with the biggest increases seen in the larger breed dogs with behavioral challenges. For all our dogs, we start meeting their behavioral needs with our basic routine care for dogs while in care. If we identify behavioral concerns for the animals, our behavior team steps in to assess and identify a behavioral intervention plan. In general, behavioral interventions will consist of extra enrichment or play groups, basic obedience, medication, and behavior modification. If we determine that behavior modification is needed, our behavior team starts with the training, then we'll reassess and modify the plans as we go along. We have some set behavior modification plans for several behaviors we can manage here. These were created by dog behavior consultants we've had on staff. I'll be sharing some of those plans with you in the resources section, but I wanted to share a specific example here with you. Kittles is a 3-year-old male neutered pit bull mix, and he came to us as a transfer as a young adult. He's a big guy, he's a lot of dog, and he was just very anxious, excitable, and just kind of rude. We went through the jumpy behavior modification plan with him, a lot of basic obedience training and a lot of play groups. As we went along with the training, we identified and listed some of the skills he was learning, and then wrote notes to describe his proficiency at each of the skills. These are just snippets from his notes, but you can see that for some of these parameters, his mastery of the skills ranges from fluency, or I'm just getting pretty good at this, to generalization, or I'm learning this in different settings, or finally to maintenance, which is I'm a master at this. By having the skills outlined and his scores categorized, it's easy for anyone looking at his record to see what he's really good at and what he's still working on. Now Kittles is a playgroup rock star, and he's even canine good citizen ready. Our formal behavior program is relatively new to us, but we've seen some really great progress already with the dogs. Some of the challenges we've identified are challenges that I think a lot of us in animal welfare face, including dogs lingering care, shortage of appropriate fosters for behaviorally challenged animals, especially for the large dogs. And then at least for us, our behavioral interventions have historically been more reactive than proactive. We're exploring things to address these challenges, including using a standardized checklist of action items for animals lingering in care, revamping and expanding our foster program, and also working on a process to proactively assess behaviors on all dogs using a standardized methods, and then planning the interventions and their reevaluation plans based on the assessment scores. I'm sharing with you our behavior modification plans, canine length of stay checklist, and the early stages of what our behavior assessment scoring system is starting to look like for us. I hope you will find these resources helpful, and if you have any questions, please don't hesitate to reach out.
Thank you so much, Dr. Sung, Joanna, and Dr. Voss. Let's get to some questions from our audience. Our first question is, can you discuss the ASV guidelines with respect to the recommendation for every animal to get out of the kennels with an environmental change daily? And I just want to clarify that the guidelines say that dogs must be provided with daily opportunities for activity outside of their kennels, unless doing so creates an unmanageable risk to the health or safety of people or other animals. So as to discuss the guidelines, and they say we have volunteers who view this standard as meaning must have twice daily walks, even if it is super rushed in and out. We are interested in quality versus quantity in this scenario where we struggle to get every animal out every day. What do you consider acceptable on the daily? Does anyone want to take that?
Sure. I mean, I agree with quality versus quantity, if possible, because I don't really think it benefits the dog to be hurried out 2-3 minutes and they have to hurry back in. I rather we have a longer walk where they can do some sniffing, if possible, do some exploratory behavior, and come back in, and we improve their environments by doing more enrichment, right? That's my personal view, but I think that there can be some modifications made. It doesn't necessarily need to be like they have to get out 2 to 3 times a day with short little walks that they're rushed through, and maybe increases everybody's stress level.
Thank you, Dr. Sung. And the guidelines certainly do not say that animals must have twice daily walks. They do not say that. It was something we debated a lot because I want animals to have twice daily walks, but we
Yes.
recognize that in the shelter environment, it can be very, very challenging with limited resources. So the guidelines do not say that. All right, let's get to our next question. And that is, what is the ideal number of dogs in a play group? The shelter I volunteer at has hired a consulting group to handle play groups, but in my opinion, they place too many dogs together and stuff has happened.
I'll answer that from my perspective. That actually for us, just personally at Shelby Humane, depends on the time of day and who we have involved with the play groups and who can supervise. So we have what we call a teenager puppy play group that can be up to 10 dogs, 10 dogs around 6 to 8-ish months old that we've introduced and paired. We have several staff members, and myself included, my behavior team participating in that yard, supervising those dogs. We would not leave a group that big alone. In the times that we put dogs out that we may be doing other things, and so we're not directly in the yard with them, they're just kind of hanging out, we tend to limit that to 2 to 3 dogs that have been supervised multiple times together and have had very successful play groups, and don't have any kind of like super rough, super high arousal play that we can trust to leave alone. So I think it's very situational, but I think most of what the resources that I've gone to for play groups with adult dogs, you want to try to keep it to 3 or 4, is what I've heard. But yeah, we do pairs if we're not going to be able to directly supervise the whole time. And then when we do large groups, it's a very supervised, controlled situation.
Anyone have?
And
Go ahead.
for us, it's very similar. It depends. So a lot of times it's pairs, but yeah, it depends on the personalities of the dogs, how well they're getting along with each other, and how many people we have who will be able to supervise, and how well they know the dogs, and how comfortable they are managing the play groups.
Thank you. Our next question is, we used to have destroy boxes and stuffed cardboard enrichment we used regularly, but had to discontinue due to our vet staff saying that they were concerned about blockages, ingestion, and encouraging destructive behavior. I feel like this is the ever-present challenge between behavior and veterinarians. Do you have any suggestions of resources or studies that support how beneficial this kind of enrichment is? I'd love for us to be able to use them in our program again.
I can't think about off the top of my head a study that says specifically don't use cardboard enrichment. Like, we know there's studies that said enrichment is really important. And I think it is a policy that each shelter needs to kind of look at. And I think I would go back and go, hey, let's look at the data. Like, how many dogs have had obstructions due to this problem? Sometimes it takes that one to make a shelter medicine team gun shy. But I would say, like, the benefits of having the cardboard enrichment is really important. And can we maybe think about, can we have a volunteer give the cardboard and kind of watch them for the first 5-10 minutes and come back every 5 or 10 minutes to check on them to see if anything is consumed, because most of these dogs would rather consume the yummy tasty treats in there versus the cardboard. I do for my puppy at home, and my adult shepherd has learned from the puppy, I'm going to chew the cardboard, but they don't ingest it. They like to chew on it like gum or something, and then they spit it out. So I would at least say, can we look at some data and maybe do a little pilot study and see how that looks like in our shelter?
Love that. And maybe also add on, ask that if we're going to implement this, we're going to observe animals when we first start offering them to see if this is an animal that does ingest, and we need to be more careful.
For sure.
All right. Thank you, Dr. Sung. Next question is going to be is for you, Dr. Voss. Can you discuss the role of management when you're doing BMOD protocols like desensitization, counter conditioning, and how they can be successfully implemented in a shelter environment?
Sorry, repeat that question one more time. The first part.
So it's
was-
asking about the role of management. Can you discuss the role of management and managing the program when you're doing BMOD protocols?
So hopefully I will answer this question the way that the best way I can. But so when we have our population, we will identify the animals that need behavior modification. And some of that is going to be performed by our behavior team. And there are some of those assessments that are going to be managed by anybody else who's got interactions with those dogs. And then the way then that we manage that we'll discuss that during our pathway planning meetings, that these dogs have been identified as requiring additional, there's something that we need to address behaviorally, and then we will discuss at that point whether that means this is a behavior modification plan or medication or both, or maybe this is just extra enrichment. So the decisions and about which animals are going to get what and how we're going to do it and which team is going to manage that, a lot of that ends up happening in our pathway planning meetings.
We'll move on to the next question is, if you have one staff member for 60 dogs, what is the best and easiest way to provide enrichment?
Are we talking enrichment in general or in the kennel enrichment? That would kind of debate on my answer. But I think that as far as numbers and quality of enrichment, I am always going to choose play groups as the number one, because you can get multiple dogs out. It wears them out. You know, if they're playing quickly, they get a potty opportunity, they get sniffing, all that kind of stuff. But if I was in that scenario, I would be using food-based enrichment. If we're talking about in the kennel, I would be using food-based enrichment that is cheap and easy. So your cardboard, paper towel and toilet paper rolls. I made the mistake of making a Facebook post asking for donations of them, and I have a mountain of people's rolls, toilet paper and paper towel rolls. I will never run out of them. So they're free, they're cheap, they're easy. It's even easier than a Kong, and obviously cheaper. So that can be that's my go-to quick and easy inside the kennel enrichment. And then play groups, if you can get proper training and you have a good yard and all that kind of stuff, it is a little time consuming, but play groups are a way to rotate as many dogs out as possible that have been tested and do well in that scenario.
Great. Thank you, Joanna. And I would just add on to that to build and grow your volunteer programs so that you have volunteers to support you. We have just a little bit of time left. This last question is for Dr. Sung. Can you assess an animal's behavior while they are on behavior meds?
That's an interesting question. Ideally, I'm thinking of two scenarios. Ideally, you see the dog's initial behavior, determine the dog needs medication, and put the dog on medication. If I have a dog that I see is already on medication and I didn't see the before behavior while it's on medication, I take a step back and assess the dog as he or she presents, right? How many incidents are we having? What is the intensity of the behavior, the frequency, the duration? I definitely can do an assessment based on the condition the dog is in at that moment, right? Because we all know assessments are based or snapshot in time of that dog, and then develop a plan based on what I see.
Thank you so much, Dr. Sung, Joanna, and Dr. Voss. So any questions we didn't make it to will be answered on Maddie's Pet Forum. Thank you so much for sharing your work with us.